Hello, and welcome to Mental Health Matters Podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton, and this week we're going to get into psychosis, which should be an interesting topic because, when you hear of psychosis, kind of like when it's portrayed in the media, I think it's sometimes portrayed in a humorous way, right? Because some of the symptoms can be, you can certainly make a caricature out of it, but in all actuality, it is very serious. And I'm going to pause for a second because my cat is apparently going to join the podcast because
there you go.
he's very annoyed about something in life. So anyway, so psychosis.
I think for a lot of people, though, it can be frightening if you're with someone who has experienced psychosis. I want to say at the outset, this is not something I deal with. My only experience with it was back in graduate school when, as part of my education, we were all required to spend 6 months working at the psych ward at the University of Utah Hospital. So, when you're working in a psych ward, then you're sort of going to come into contact with people who are experiencing psychosis. And so the question is, to start out, what is psychosis?
Mm-hmm.
And so I think that in simple terms, psychosis is where there's something happens in the mind or the brain that there's a break with reality or contact with what is real. And so the person's, during a psychotic episode, the person's thoughts and perceptions are disrupted. And so they have difficulty really knowing what's real and what's not real. And so the most common way, there are two most common ways that people experience this, and that's with what we call delusions. Mm-hmm. Or hallucinations. And so for an example, in my work, I've had one or two experiences with clients that have had delusions, one with hallucination. So a common one is that you think, like if you're watching television, this delusion that they are talking directly to you and they're giving you some sort of message. And that those delusions like that are often accompanied with paranoia. Mm-hmm. And so you get paranoid, like someone's watching me, because how could they say this to me if they weren't watching me? And so there are cameras that I can't find that are in my living space, and they're watching me, and then they're sending me these messages. So that's an example of a delusion. And then the paranoia that I'm being watched or I'm being followed. And then as far as hallucinations, that's kind of an easier one to understand, seeing something that's not there.
Right.
And that's common. Not common. It's as far as people who are experiencing psychotic breaks, having hallucinations is common. But the research on this is kind of interesting because it's not clear how many people experience this, and I think I understand the reason why. If you look at the data, there's what I read was anywhere from 15 to 100 people out of 100,000. Now, if you think of that range, 15 to 100,
that's a lot.
That's kind of a big range.
Yeah.
From let's say smaller to much bigger.
Mm-hmm.
So it's unclear, and I think part of the reason is that, I think people wait too long. Like if you're having a psychotic break and people are around you, or you even, I think it's hard for you, the definition of a psychotic break is it'd be hard for you to realize that you're actually experiencing this.
Yes.
So to expect someone on their own to go get help, I think that's pretty unreasonable. Because they think it's real.
Right. And I think so a couple of things come to mind here. One is important to differentiate between actual psychosis and drug use. So,
because what
you're describing sounds like if you take some sort of hallucinogenic, like ketamine could probably induce this, or even, like a methamphetamine or
Right, right.
possibly marijuana, like those can induce hallucinations. That does not necessarily mean you're having psychosis. I think that's important to differentiate.
That is really important. And so if you talk about, well, what causes this, then you
Yeah.
have to, before you can say, well, this is a psychotic break, you have to rule out all these things. I mean,
Yeah.
I have a sister-in-law, and I believe she's clean now. I don't have much to do with her, but years ago,
Hmm.
it was fascinating to hear about what she saw when she
Yeah.
was high,
Hmm.
like little helicopters flying around her house. Well, the sad thing was she has these two kids, and they were young at the time, and she convinced them that
Oh
there were
no.
little helicopters flying around, but it was during an episode of being high. It's
Yeah,
sad. It's really sad because
it is,
it
because I mean those
tends
kids,
to
yeah. Those
tends
kids
to
just think,
traumatize the kids.
yeah, well, and the kids probably think mom's playing make believe. They probably at first thought it was great. Oh yeah,
Yeah.
there's helicopters, and yeah, that's pretty unfortunate. So it's important to differentiate between that, and the other thing too is psychosis can sound similar to schizophrenia as well.
Well, yes, but that's one of the diagnoses. So schizophrenia, bipolar,
Hmm.
even really deep depression can lead to psychosis. So I don't know that they're separate,
Right.
like the diagnosis of schizophrenia and psychosis. I think that if you're schizophrenic, then you can have a psychotic break, and so
Hmm.
it's one of those things that happens in people with other diagnoses. I think we should also talk. This gets a little tricky talking about this because I don't know if this is going to go into the political realm. You can tell me, but are you familiar with Q, or that whole idea of QAnon?
I've heard of QAnon.
So I did.
Yeah.
You've never mentioned it to me, so I didn't think it was something you. But there's this whole, like, this is a whole shift into big conspiracy theories. I think
Yes.
dark web. And the only reason I know this is because there happens to be someone who is seen in our facility, and so the belief, like, this is just one. I mean,
Hmm.
um, but one belief, and the reason I bring this up is I would guess there are tens of thousands of people in our country who believe this thing. So one of the
Hmm.
beliefs is that there's a system of underground rivers throughout the country, and submarines are going, and they're transporting children. So there's this whole thing. They're transporting children, and the children are being killed and used for, I always forget what it is. It's something with the pituitary gland that somehow keeps adults younger. So,
Oh, okay.
okay, so I mean, there's this whole reason. I mean, here's the amusing thing. This thing I find amusing, that they really think that Biden is in charge of this and that he's using this stuff. And my
Oh,
response is always, well, it's not working very well.
I mean,
If this is true, I think
yeah,
he probably ought to
yeah,
find something else because
right. I mean,
it's not helping him.
yeah, yeah,
See, I think I've said this before. I think he's got Parkinson's, but in those types of things like Parkinson's, Alzheimer's,
yeah.
you can also have psychotic breaks, real
Oh,
psychotic
okay.
breaks. Okay, so that's a real thing.
And
Anyway, getting back to my point.
yes, we are not inferring that the
No, I'm
president of the
not.
United
I'm not
States
at
has
all. I'm not.
psychosis.
I'm not. I'm not inferring that at all. I'm just saying it's really tough
Yeah,
to decide. Okay, what is psychosis and what's not? Because if you have tens of thousands of people who truly believe this idea that there are underground rivers with submarines, is
yeah,
that psychosis? See, I don't think it is. I don't think it fits the
yeah.
definition of
I agree.
psychosis because I mean, you can't have tens of thousands of people sharing the
Mhm.
same psychotic break. That
Yeah,
doesn't fit.
yeah,
If,
but
however, you had one person who, in says, "Well, I really believe this, and I've seen these rivers, and I've seen the submarine," that I think would fit a psychotic break. So you see, it gets tough, and even culturally, I think you have to be careful because, for instance, in certain, like in a spiritual realm, some people could say, "Well, I've experienced this. I'm not." Don't want to call it hallucination because that isn't how they experience it, but they
yeah,
see, say, a spiritual being, and some people are going to say, "Well, that's not possible."
right.
But from the cultural context, that is different, I think, than a psychotic break. So it gets really, really tricky
Yeah,
to kind of parse out what is going on.
it can. Yeah, and I definitely can see that. And I think that is an important distinction
Mm-hmm.
to make, right? I mean, because that immediately makes me think of my own religion
Right,
and Joseph Smith in the First Vision. Do I
right.
believe that that was an incidence of psychosis? Well, obviously not, because I followed the entire religion.
And so I think it's important that you take into account cultural and
Yeah.
spiritual and religious aspects. And I think I don't know that anybody, well, maybe some people would uh, say that that's a psychotic break. I don't think that's true. It
No.
just doesn't fit.
Right. Well,
And
and I think the important component here is the action the individual takes, right?
right,
So I mean, if we go back to this example of Joseph Smith, he didn't go out and, I mean, well, maybe some people out there might say he formed an entire religion based off of it, but again, it just doesn't fit, because he didn't go out and harm anyone, or or attempt to do anything so crazy that it would fit into this realm of psychosis, right? And he lived this whole very, very normal life, right?
right. And so what I think now is what we can do is talk about some of the behavioral warning signs that go
Yeah.
along with psychosis, because I think that is an important way to distinguish,
Hmm.
what's going on. So these are common. Now, these are not going to happen in every case. This is our disclaimer that we like
Yep.
to say. And even if people are experiencing some of these, doesn't mean they're having a psychotic break. It's
Yes.
just this is information that anyone who is trying to do a diagnosis would want to take into account. So
Hmm.
suspiciousness, I mentioned paranoid ideas, uneasiness with others. That seems to be fairly common nowadays. Trouble thinking clearly and logically. You withdraw socially, spend a lot of time alone. Intense ideas, unusually intense ideas, strange feelings. Decline in self-care and personal hygiene, I think, goes along.
Yeah.
You just, if you're having a psychotic break off, um, I think that's probably a common one. That's what when I was up in the psych ward at the university, that was a common one. Here's another common one: disruption of sleep. And I think that I've mentioned that before. I think it's pretty well known that lack of sleep or going for a long period of time without sleep can certainly bring on a
Yes.
psychotic break and a psychotic
Yeah.
episode.
Hmm.
And so I talk to I'm not saying I have psychotic clients. I have clients who are dealing with anxiety and depression. And I know I've said this before. You've got to re-regulate your sleep.
Hmm.
In most mental health issues, lack of sleep or disrupted sleep is a huge component. And that's certainly true with psychosis, but it would be more extreme. So
Yeah.
if somehow you know that someone's going multiple days without sleep, which happens,
Yeah.
then that's pretty likely to uh,
Cause.
cause a break.
Yeah.
Confused speech, trouble communicating, sudden change in either job performance or if they're student grades. So anxiety, high anxiety. Again, a lot of people experience anxiety. That doesn't mean you're going to have a psychotic break. These are just things that you'd want to be aware of.
Hmm.
And then maybe the most important one would be somehow they're having difficulty functioning at all. And so if you have a person who's either high functioning or functioning well at work, with family, with friends, and that then suddenly changes
Yeah.
to where you would look at them and say, wow, this person is not functioning well at all. That, I think, is an important marker. So hopefully that helps people to be able to distinguish, what this is. And it's tricky. It really is to
Hmm.
figure it out. But it's this whole range. You can't just hear someone say, well, I have this weird, unusual belief about submarines going underneath the country. You can't say, okay, that's a psychotic break. You have
There's
to have
also,
you have to have a lot more information.
right. I mean, because there's also many, many, many people in this country who believe that Michelle Obama is actually a man. And I don't
Yeah,
think they're psychotic. I think they
right.
just give into conspiracy theories
Well,
because,
that's it.
you
Okay, that's
know,
it right there. That's it right
yeah,
there. Yeah, I don't know. There's much more to say about. It's
y-
hard to.
it can
Hard.
be.
I don't know if
Yeah.
it's hard to distinguish. You need more information than
Yeah.
just what you're hearing.
Exactly. So One thing that keeps coming to mind in an incident of psychosis again, and we keep going political, but I think this fits, is the shooter who tried to assassinate Trump.
And
I
I
think,
haven't read much about that. Tell me what you mean. Like how might that be a psychotic break?
well, I mean, I don't know. I think maybe just shooters in general. I think that has to be some form of psychosis when somebody goes out and thinks, I'm going to go shoot somebody for whatever reason. I don't know. What do you
Um,
think?
I don't know that that fits unless
Okay.
there's this use. Here's how I think it could fit. And so I don't know,
Right.
this guy who I haven't read anything about him. But let's say that you had a delusion
Hmm.
that Trump was an alien or, something like that.
Yeah.
And you said, well, I need to shoot him or I need to kill him because he's doing something to me. He's sending out these signals to me.
Right.
That then
Or he's going to turn the country over to, or the whole world over to aliens, or something.
something like
Right.
that. So
Yeah.
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 So do you see how it's the belief system that
Okay.
might be behind that
Oh, okay.
that I
Yeah.
then so to just because I think there are plenty of people who think, well, I actually don't know the reason this guy did what he did. I
We weren't
I
able, I don't
I
think,
haven't read anything at all about it.
right. Well, I
Um,
don't think anyone was able to discern anything concrete from
yeah,
it. So,
yeah.
I mean, and he
So
died. So,
I'm not saying there might be some mental illness.
I, and that
I
is true. Anybody who decides to go out and
Yeah,
just shoot
right,
somebody, I
right.
think has some sort of mental illness. Another,
I don't know that it falls into the range of
okay.
a psychotic break though. Uh,
Okay. Yeah.
You'd have to have more information on what his belief system was.
Yeah, that makes sense. Well, because another thing that I think could be attributed to psychosis, or that makes me think of psychosis, is a school shooter. I mean, what could
Oh,
possibly drive somebody? And again, I think it could fall into the incidence of psychosis, but what we do know is that it is clearly some sort of mental disorder going on, because a mentally healthy person does not just go out and decide to shoot people. Like, that
yeah,
is
yeah.
not something that happens when you are a mentally healthy, normal person, right?
Yeah,
There's
and
something seriously going wrong in your brain.
I agree with that. And so I think before we could say, well, there's psychosis involved, I think you'd have to know the motivation.
Okay,
What's
that
the
makes sense to
underlying
me.
belief system? And
Yeah.
I don't pay enough attention to those things. I think they're awful. It's not that I don't think they're
Right.
awful
Right.
situations. It's just it it's not really that interesting to me
Yeah.
to understand. But I think it could be that certainly.
Okay. Yeah.
So I think we mentioned the other. I think I mentioned briefly. Just want to go back. It could sometimes it's medication induced. So there are all these things that you need to rule out. Older
Yeah.
adults are at risk because of things like Parkinson's, Alzheimer's, things like that.
Hmm.
Um, so again, if you have an older adult that is experiencing those types of things, you really need to get help
Yeah.
from a professional because we could move into treatment. What do you do, with people who are having psychotic breaks? I think the hard thing is, and this is especially true with schizophrenia,
Hmm.
that it's very hard to get treatment, especially if what happens often with schizophrenia is there are medications that can keep that in check pretty well now. And
Yeah.
what happens is the person's taking the medication, they start to feel better. They realize they're feeling better and they say, well, I don't need this medication anymore. And then it flips them right back into, the schizophrenic episode and psychosis. So I think there are the current research on what you do with this is very similar to what we've talked about, say, with depression, that it's a combination of medication and talk therapy. And so the medication makes sense that there are things you can do to help calm the brain so that you aren't experiencing the paranoia
Hmm.
and so the delusions or the hallucinations. But what they found, which I mean, it just supports my belief, is that there are brain changes that happen in talk therapy, and
Hmm.
we know that. And some of it has to do with attachment, but a lot of it is just that connection with another person who is, really seeing them and seeing what they're going through. That actually results in positive brain changes, and so they're finding that that you really need to have some sort of talk therapy that goes along with the medication for people who are psychotic, and that can have a positive outcome.
Right. I think that in terms of severe psychosis as well, right? Or because you hear, oh, they had a psychotic break. And in instances like that, I think another viable option is some sort of institutionalization, right? So like hospitalization. I guess
Right. And
institutionalization probably isn't the best word to use, but some sort of hospitalization could very much be appropriate in the short term to help them, process through this major psychotic episode.
I think that is really about stabilization
Yes.
and stabilization on medication. And also, at least my experience, and this was a long, long time ago, so it may have changed in the psych ward. My experience in the psych ward is that they do the medication okay. They don't do the therapy, the talk therapy, or at least they did not back
Okay.
then do
Yeah.
that very well. The biggest problem with that is that you cannot force someone into an institution
Mm,
unless there are specific things going on, and most of
right.
those would be harm to self or harm to others. And so, if the person does not want to be institutionalized or go in inpatient treatment, and there is no evidence of either risk of self-harm or harm to others,
Hmm.
then you're stuck. You can't
Mm,
force that. And so, but sometimes if there is a clear risk to harm to self and harm to others, then you can. There are, I think, in most states, mechanisms by which there are people who can force that.
right. So, I mean, for example, if somebody is threatening to go out and shoot people,
Right,
that is a
right,
clear
right,
indication that would warrant, right? And
right.
so I think something else that I want to mention here is a plug from an episode we did a couple weeks ago, 988 with Monica Johnson.
Right,
So
right.
if
Yeah.
someone is experiencing a severe form of psychosis, or if they are out of control, 988 is a good option to call
Hmm.
as opposed to 911. uh,
Yeah.
if you go back and listen to that episode, you can hear, or you can understand why 988 could be a better option than 911. And not that 911 is not an important element or that you shouldn't use it in a need, but 988 could be a good option to have somebody come out who is more familiar with behavioral health complications.
Yeah. I think the difference would be if the threat is imminent, then you really need 911.
Yeah.
If you're struggling to find resources or what do you do, then it seems like 988 would be the better option because
Hmm. Yeah.
you get people who are familiar with what's going on and give you direction. Because I think really often what happens, if you are with a loved one who is experiencing a psychotic break, you don't know what to do.
Yeah.
And so you really have to have a place to go where you can get a direction. I think I mentioned this earlier. Often what happens if you're around people who are having a psychotic break, I think our brains are really primed to be afraid of things that are different
Yeah.
because that's, in a lot of ways, that's how we survive. But I think the vast majority of people who are having a psychotic break are not dangerous.
Hmm.
And so it's really important to realize you don't have to be afraid of them.
Hmm.
I think one of the ways that you can talk to them, so if you have a loved one who's experiencing this, is it's important. You cannot say, "Oh, no, you aren't having that's not true," or that
Right.
thing you're seeing isn't true. You don't want to do that. And you want to be able to just understand it from their perspective and be calm. I mean, it's important to be calm
Hmm.
and to understand what they're going through and to be supportive. Sometimes, not all the time, who's paranoid or having that delusion or hallucination, you wouldn't want to touch them. You want to be careful about that type of contact.
Hmm.
And so you don't want to push them into this place of say, I would never say to someone, well, you're having a psychotic break, and because it's not going to mean anything to them, and they're going to deny it because in that moment, to them, this is their reality.
Yeah.
What they are experiencing is their reality,
Yeah.
and so that's how you approach it. And I think you standing back and say, okay, this doesn't seem normal to me. It seems like a break. I think you'd work on calming the other person helping them through that particular episode. And then on the side, you're thinking, okay, I need to get some help as to where we go with this.
Yeah, because the one thing that you can determine is if there is genuine psychosis going on, you need professional help.
Right. I think that's true. And so, but in that moment,
Yeah.
it's important not to say to the person,
Yes.
we need to get you professional help. You don't want to do that. You just want to help calm them down because they're going to be agitated. They're going to be really agitated.
And their fight or flight response is either triggered
really
or
activated.
Yes, it's either triggered currently or going to be.
Yeah.
And and when your fight or flight response gets triggered, you do all sorts of crazy things. I mean, I have a good example of this. My oldest is she has a genuine phobia of needles, and I have literally watched
Beetles?
Needles.
Oh, needles. Okay. I thought you said beetles.
Oh no, that's
needles. Okay.
Yeah, needles. So like shots are part of life. So flu shot, vaccinations, right? And I've literally watched her fight or flight response get turned on. And I mean, I've seen her 11 years old trying to climb behind an exam table to get away from this needle that she's, terribly, deathly afraid of. And so you want to be careful not to trigger that further or do anything to further agitate. So I think, like you said, is remaining calm is going to be critical. In that instance, remaining calm yourself, because when you get worked up, they're going to sense something is wrong. Yeah. And, and again, contacting 988, that's going to be a great resource. If there is threat of imminent danger, if they're acting so erratically that you are afraid someone is going to get hurt, 911 is certainly an appropriate option. And one thing that I will say that is really amazing with the 988 program is, and this is going to be a slow incorporation, unfortunately, but I love that they're doing that, is they are starting to work with 911 to try to better facilitate getting some sort of mobile response unit for a mental health crisis, right?
We need that.
We do. Yeah. Because I mean, I think in the terms of psychosis, and I said this before when we talked about 988, police officers are a wonderful, valued, and very important resource in our community, within all of our communities, but they are specifically trained to handle situations in a certain way. And sometimes, and usually it's with force, right? Like they're taught and trained to be, they need to be forceful. They need to, be assertive so that they can control a situation. That's not always helpful in the terms of a mental health crisis. So, I think working with somebody who is experienced and who can be more understanding, I love what 988 is doing.
Yeah. And I think there are some police departments who are trying to do a better job of training. Yeah. But it goes back to what I said, that it can be frightening. And so even for a police officer, you can go in and you can experience this, be with someone on a psychotic break, and that can be scary. And so they're trained to respond to certain situations when they believe there's a threat of danger. So these people, I get it, can appear threatening. Yeah. I really believe the vast majority of them are not. Though.
Right.
And that's
vast majority, yes. Yeah.
Yeah. And so that you're absolutely right. It becomes really tricky about how you respond. And so we do need this collaboration between 988 and 911. Hopefully we can change the way we respond to people in mental health crisis, because it happens often. I mean, it's not something that is infrequent. It happens frequently, and we need to respond to it better.
Yeah, absolutely. Okay. So takeaways.
Takeaways are to determine what a psychotic break. If someone's having a psychotic break, you really need more information than just what you're seeing.
Yeah.
It's because it's a constellation of events. And I think paying attention, I think sleep deprivation is a big one.
Yeah.
Change in functioning is a big one. So pay attention to that. And then don't try and convince the person that what they're experiencing is not real. You just try and calm them. Stay calm yourself.
Yeah.
And then get help.
Yeah.
And so, as you mentioned, 988 could be a resource, because people, I think maybe one of the big takeaways is people often don't know where to go for help because it's not something we talk about very often.
Yeah.
And so maybe realizing that as a first stop, talking to someone at 988 as a way to get a direction.
Yes.
Can at least give people help in that way. Where can I go for help?
Yeah.
So I think that's a big takeaway.
And how can I interact with this person in a safe way that isn't going to agitate them, right? Is going to be, is going to be a really good one. Okay, this is a bit of an aside that I just thought of. So I see a sleep doctor, and one of the questions that they asked me, and he said, when you wake up, do you see things that aren't really there? And I thought, that's kind of a weird. Yeah. And so I wonder if, that could be, but it fits because sleep can be a part of psychosis. And I mean, I've never experienced that, but I imagine that that's something that he asks all sleep patients and it could be that maybe you think you're sleeping and you're really not, or maybe you think you slept and you didn't, right? So, sleep is a big one.
Let's say if you do wait, I think the reason they're asking that question, I mean, it could go either way. It could go, yes, you're having some sort of psychosis, but I think also it's an indication of some disrupted sleep or an inability to move from that sleep state to an awake state. That there are some sleep disturbances where it's difficult to make that transition, and that's probably what they're trying to ascertain. Which is a good thing to ask. I think it's an interesting question. A good question. Yeah.
Well, because that could be a form of psychosis. I mean, when you're dreaming, your dreams feel real to you very often, and so that could be that could be an important form of psychosis. Okay, so next week we are going to get into attachment, which is something that I am learning about in school, but it's important and it's not something that's talked about very often. And so attachment begins usually in infancy. So we're going to talk about what it is, why it's important, and what can happen or what you can do if attachment is either disrupted.
Disrupted is what we call it.
Yeah. Or, maybe never formed in the first place.
Mm-hmm. Right.
Okay, we will see you all next week.
Have a good week, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.